Hello, my name is Thomas. I'm a certified nutritional practitioner and medical laboratory technologist. In this video series, I'll share with you what I do in the medical lab as a medical laboratory technologist and how I gain insight that medical lab testing alone may not be sufficient in finding the actual root cause of a health concern, and that we should look at additional lab testing such as live cell microscopy may be useful. So when you enter a hospital, the doctor notices that you have shortness of breath and also pale. The doctor is most likely going to order a CBC. The blood sample is drawn by a nurse and is sent to the lab, and the medical laboratory technologist runs it on the CBC analyzer, and the CBC analyzer spits out information regarding your red blood cells, your white blood cells, and your platelets. If the CBC analyzer flags something abnormal such as low hemoglobin or low platelets, it is spread onto a slide and fixed with alcohol and stained using H&E. The medical laboratory technologist then look at the smear and it could be normal. It could be a morphology indicating a pathology such as sickle cells, which indicate sickle cell disease, or increased polychromia purple cells and increased spherocytes, which are dense-looking cells, which may signify autoimmune hemolytic anemia. Or you might even see parasites, which looks like banana forms and ring forms, which may indicate that you have malaria. And also, you might even see cancer cells in your blood called blasts, which indicates leukemia. So the pro of this technique in the medical industry is that it's excellent morphology to indicate a specific pathology. But the cons is since that we stain it and fixed it, the cells are no longer live and we cannot see the activity of the white blood cell, and anything in the extracellular matrix is actually deemed artifact. But as we know, anything that surrounds the cells, for example plaque, is of clinical significance. So even though that the medical industry doesn't look at blood lively, it does actually look at the urine lively. Say when you enter a doctor's office and doctor see that you have indication of a kidney malfunction or urinary tract infection, the doctor may order a urine analysis. The urine is sent to a lab and the lab does a dipstick on it to analyze the pH of your urine, any presence or absence of cells such as red blood cells or white blood cells, and among other things. If it's deemed abnormal, then the medical laboratory technologist actually looks at the urine in the microscope lively. It looks at crystals, abnormal or normal crystals. It looks at aggregates of cellular forms or hyaline forms, and it may even be able to see bacteria. So all these things might be good indicating of a pathological indication. So even though the medical lab industry does not do live cell microscopy, maybe because of the time constraint that it requires, the alternative lab technician does do live cell microscopy. In this procedure, a finger prick a drop of blood is cover slip onto a slide using a wet prep technique, and it is viewed under the lens of a dark field microscope. This is projected on a monitor and you will see a video of your blood when it is live where cells would be illuminated and the background will be dark. The pros of this technique is that the activity of WBC and anything in the extracellular matrix are not destroyed, so that we can actually see things that may be subclinical or clinical significance to you. And the cons of it is it's less than single cellular morphology, and we cannot make pathological statements or disease that you may have, such as from the live cell microscopy, we can't say you have sickle cell anemias. So why live cell microscopy? It's a good education tool to study the structure and function of your blood, your red blood cells, your white blood cells, and extracellular matrix when it is live. It has a well-researched indication of health based on hematological and Dr. Enderlein principles that conventional medicine largely ignores unless it is part of a pathological picture. So what it can state about your health can be subclinical, such as inflammation, oxidative stress, nutrient inadequacy, digestive insufficiency, liver stress, immune status, presence of polymorphic microorganisms. We now know that blood is not actually sterile, allergies, hormonal imbalance, and general toxic load. I want to emphasize that we must correlate these live cell microscopy information with other lab tests and symptomology to indicate what may be the root cause of your health concern. So this is a regulating live blood picture where you see a good red blood cell health here, and also surrounding your cells is these proteins which suggest that your immune system is balanced. And we could also see abnormal RBC morphology in live cell microscopy, but we take this more seriously. So we can see the fear inside your red cells, which may indicate nutrient inadequacy, which is B12, iron, selenium, or organ pathology. And we might see membrane irregularities, such as acanthocytes, poikilocytes, or echinocytes, which suggests increased sensitivity to oxidants or oxidant pathology, and that you may need antioxidants. And here we see a hormonal imbalance when we have increased ovocytes. We also see WBC morphology like conventional medicine, but you actually see this in the video screen, and they're moving as well. So you see neutrophils, and when they're hypersegmented, it may indicate a B12 and folate deficiency, and increased numbers means maybe acute inflammation factor infection. And you can see also increased lymphocytes, which suggests maybe a viral infection, immune dysregulation. Increased monocytes, which maybe mean that you have acute and chronic inflammation, infections, immune dysregulation. Or increased number of eosinophils, which mean you may have allergies, parasitic infection, or organ pathology. And we may even see increased numbers of basophils, which means you have allergies, inflammation, organ pathology. What's significant about live cell blood analysis is that we can see a congestive live blood picture where we can see the surroundings of cells and how it's subclinical indicating something about your health, such as increased fibrin, which shows that you have inflammation and liver stress, platelet aggregation, which shows that you have overall stress, increased overall stress and cardiovascular risk, what I call blood casts, such as crystals and protoplasts, which may indicate inflammation and organ pathology, and also digestive inadequacies, so such as chylous materials, chylomicrons, increase even after fasting for 4 hours. Means you have a problem with fat digestion, or protein linkages and protoherbins, which suggest that you might have a problem with protein digestion. So we can also see degenerative blood picture where there's a blood sludge, means your blood is very acidic. Or we can even see polymorphic stuff going on in your surrounding your cells, such as rod forms, which may indicate that if you have a lot of these, it may indicate that you have a depressed immune system. During our live cell microscopy, we also do a second test called oxidative stress test, which your blood is dropped onto a cover slip, and then it's exposed to air for 30 seconds. And then from that, we can see a normal blood, or if your blood cannot take the stress of the air, there might be a lot of white spots surrounding your cells, signifying increased oxidative stress. Or we may see in the middle of your blood that you have inflammation hole, which indicates a massive bowel inflammation. So in conclusion, medical lab testing is useful to give insight about your health in general, but it may not be able to indicate subclinical information about your health that may be the root cause of your health concern.